Okay, great. Well, good morning and welcome to everybody to this Life Sciences Executive Summit of the Chamber of Commerce. Welcome to everybody who's here in the room and welcome to everybody who is joining us online. I'd like to begin by acknowledging that we're gathered on the traditional territory of the Anishinaabe Algonquin Nation. The Canadian Chamber of Commerce recognizes and appreciates their historic connection to this place. We also value the contributions that the Inuit, Métis, and other Indigenous people have made both in shaping and strengthening the community, this province, and this country. The future sustainability of the healthcare system relies on the ability to make data-driven decisions. The pandemic showed that the use of real-time data allows for timely and informed decisions. The next step is to identify how to better share, integrate, and use standardized health data to evolve the healthcare system from one that is managed with messy healthcare to one that is driven by actionable insights. Public and private sector collaboration is critical to achieving the government and healthcare system objectives of a world-class integrated health data ecosystem. This executive summit will discuss how leveraging these collaborations creates an environment where the sharing and integration of standardized health data drives innovation, health system efficiencies, and better outcomes for all Canadians. The Chamber would very much like to thank our presenting sponsors, Roche and IQVIA, and in particular, I would really like to call out to Logan Carragata from Roche and François Laflamme from IQVIA for the incredible support that they provided in organizing this event and making this event happen. Thank you. I should also mention that Logan plays a huge role in our Life Sciences Council, and François is co-chair of our Health Innovation Committee. So truly very engaged members of the Canadian Chamber. And now over to our esteemed panel. What we're going to do is I'm going to ask them one by one to introduce themselves and their organization, and then we'll go to the panel discussion. There will be time for questions at the end. So people who are online, please feel free to put your questions in chat, and my colleague Liam will read them out at the end when we get to the question period. So now over to the panel, and we'll start with you, Emmanuelle.
Thank you, Kathy. So delighted to be here with you this morning. My name is Emmanuelle Lamoureux. I'm DG for Healthcare Strategies at Health Canada. My portfolio includes mostly the implementation of the plan that was announced by government in February, and which provinces and territories have endorsed since, and which includes funding, but also commitments, including commitments related to health data. Portfolio also includes digital health and health data, both the policy aspect of health data, but also the analysis aspect of health data. My background is maybe a bit unusual for this room. My background is actually diplomacy. I spent most of the last 20 years living abroad, including in other OECD countries. I've had the chance to observe how healthcare is delivered in different contexts. And I'm, in the context of my work at Health Canada, I spend a lot of time speaking to the two gentlemen on my right, and we collaborate a lot with the private sector as well, because we view them as an important very important stakeholders and partners in, transforming our health system, modernizing it, and innovating for the benefit of better healthcare for Canadians. So I'll stop there.
Merci beaucoup, Emmanuelle.
Okay, well, thanks very much. And it's great to be here. Michael Green, I'm the President CEO of Canada Health Infoway. Been there 9 years. Before that, I was in the industry. And, just a little bit about the organization. We are a not-for-profit organization. We're funded by the federal government, and all the provinces, territories, and the feds are members of our corporation. And our remit, really, the company was formed 20 years ago, and the idea at that stage was to come up with a strategy for Canada to introduce the electronic health record. And over time, we've invested about $2.5 billion worth of funding into specific projects. First of all, to kind of build the electronic health record infrastructure and data repositories across the country. Our team kind of looks at standards as well as, specific areas like privacy, cybersecurity, and so on, as well as what we used to call kind of strategic investment, kind of working with the PTs and with private sector to put in innovative tech. And I'm sure we'll be talking about it more at this particular session, really that our current one is really very much focused on spreading digital care across the country. And, it's quite a challenge, as you all know, in our fragmented field, and takes an awful big array of different partners to make this successful. And definitely private sector very much involved in the middle of that process. So thanks very much. Look forward to the discussion.
So much. Over to you, David.
Thanks very much. David O'Toole. I'm the president of the Canadian Institute for Health Information. I'm really delighted to be here today. I was talking to Brigitte about this. There's the subject areas that's going to be covered here seems to be quite timely and popular in different fora across the country. We spent, as a country, $344 billion on healthcare last year, and CIHI provides some visibility into about 240 of that. There's another 100 billion, which we need to work with folks in this room on, that we don't have much visibility into because it's delivered privately. And that's something which I think it's in the interest of all Canadians to try to build the sorts of bridges that permit data sharing and insights across the sectors in the public interest and in the interests of the economy, as well as innovation and research and development. We're about 30 years old. I don't report to a minister, which I have to tell you improved my quality of life immensely when I came here 10 years ago. We're run by a board that represents the regions and provinces across the country, as well as subject matter expertise. We collect data from different domains. We have a lot of data, likely on every one of you in the room. Hospital data, long-term care data, pharmaceutical data, data related to health workforce through various accredited professions, patient-reported outcome information, patient-reported experience measures. So we have a lot of information that's provided to policymakers, program designers, the research community, private industry, in the interest of fostering innovation and development, but we're not nearly as proficient or effective at as we could be if we get to some of the challenges that we're going to be addressing here today as a group. So I'm delighted to be here, and thank you.
Thank you very much. Over to you, Brigitte.
Alors, bonjour, chers collègues. Brigitte Nolet, je suis la PDG de Roche Canada Pharmaceutique. Merci pour l'invitation. Merci. Je suis ravie d'être parmi mes collègues ici et de faire partie de cette discussion importante aujourd'hui. So I'm Brigitte Nolet. I'm the President and CEO of Roche Canada Pharmaceuticals, and it's a real pleasure to be here today with all of you. I think to echo a little bit of what's been said, like Emmanuelle, I've had the pleasure of working abroad and have just come back to Canada over the past year, and I've been in a number of global and European roles. And I think what I can observe coming back to Canada and in the last year is this wealth of momentum that we were just talking about, weren't we, in terms of where we see the governments in Canada really want to go. I think that we all know that in order to move forward with a real transformation in our healthcare systems, we're going to have to get our health systems talking to each other and working together so that we can make the right research decisions, the right clinical decisions, the right public health decisions all together. And so my role on this panel is really to talk about the public-private partnership approach and how we all need to work together to get this solved. These are big topics. We see them moving very quickly in other jurisdictions. I think you just have to look to the EU and the work that they're doing together as a collective of 27 countries to move forward on the topic of health data, to know that it's going to be important. I think what I'm encouraged by is that we've got these fabulous people to my left and to my right that are working to really make a change for us. I don't think it's too late. I do think, however, it needs to move with urgency and it needs to move with cooperation and coordination among us all. And I think if that's what we can come to today and in the weeks and months to come, then I think we're really going to make a change that will have a real benefit for Canadians. So thank you again.
Merci beaucoup, Brigitte. Over to you, Sarah.
Thank you, and it's a pleasure to be here. My name is Sarah Lyons. I'm with IQVIA, a global human data science company, brings together the power of data, analytics, technology, and expertise to drive advancements in medicine and healthcare globally. And my role with IQVIA is our global head of data transformation and AI platforms. So a lot of what my focus day to day is on is empowering the establishment of data foundations to get to meaningful data for us to truly advance healthcare, from integrating complex sources of health data to protecting and enhancing privacy with privacy enhancing technologies, structuring very unstructured health information as being critically important, and also mapping to open standards. I think openness is critically important for what we need to achieve at a national level. And I'll just echo what Brigitte shared, because I think at this particular juncture, we've heard from fellow panelists, there is a lot of momentum. There's a clear impetus to act. And we can draw inspiration from international examples around us where a lot is happening. So I think this conversation is very exciting to be having today. No doubt some complex challenges, but really interested to explore how we can move forward together.
Thank you very much. Thank you to everyone. So let's dive right in. The first part of our conversation is going to focus on the situation in Canada. So the first question is really addressed to Emmanuelle, Michael, and David. And really it is focused on what is the health data and digital health vision and priorities that lie ahead within the context of the Working Together to Improve Healthcare for Canadians plan.
Thank you. And that's quite a mouthful, right? That's why I had to read it. I'm sorry. No, that's agreed. We call it for short, the Working Together plan. So we can, or even the WT plan, but let's go for Working Together. No, thank you, Kathy. And I think to start, as you said earlier, I think the pandemic really evidenced the need to address some of the long-standing challenges that our system was facing before the pandemic, but they became very evident during the pandemic. And we have a window now to do that, which we should not lose. Canadians are proud of their healthcare system, universal, public, but I think they also recognize the fact that there are some pretty serious issues that we need to work on urgently and that we need to address. Hence the momentum that Sarah was referring to earlier. We have, like most OECD countries, an aging population. We also have the fastest growing population among G7 countries, thanks to our, ambitious immigration targets. Absolutely essential from an economic perspective, but we also need to make sure that we're able to provide all Canadians, including new Canadians, the services that they expect. And there are also, we know, challenges that will stem from climate change. So we need to be prepared for this and for the challenges of today and tomorrow. We were referring earlier to this health expenditures. Canada is spending significant amount of money on healthcare, 11.2% of our GDP based on OECD stats, which places us among the top spenders. And despite this, what we see is we still face challenges in terms of access to regular healthcare providers. I think the latest CIHI data say 14.5% of Canadians don't have access to regular healthcare providers, but some recent studies actually show that the number may actually be higher, up to 1/5 of Canadians. I think Canadians expect different results for the amount we spend. We also know that our healthcare workforce has been fragilized through the pandemic. A significant number of our health workers are approaching the age of retirement. Access to services in general is an issue, but particularly access to mental health and addiction services. Pandemic has also evidenced vulnerabilities in our long-term care system and home care services we offer to our senior residents. And finally, and that's, I think, what several of us are interested in today, our system is in need of modernization. And despite successes in digitizing data, our systems don't connect. So between healthcare settings across borders, what we're seeing is, serious challenges in terms of making sure that the data circulates, to make sure that, we offer to Canadians the quality of care that they expect, to, ensure their, the highest degree of patient safety, and also to reduce inefficiencies, because, a lot of duplicate testings, a lot of inefficient service delivery still occur in Canada, and that's something that needs to be fixed. So one of the tools that we have at our disposal to do that is, of course, to harness the full power of data and digital tools. And that's exactly what we intend to do with the plan. So let me describe a little bit what this working together plan is about. One component of it that has been publicized is the funding component, $200 billion over 10 years. And that includes some new funding for provinces and territories that will flow through bilateral agreements that are currently being negotiated. There's one that's already been announced with British Columbia, and more to come. But there is also another component to the plan, which is a commitment to collaborating between federal, provincial, and territorial jurisdictions in two specific sectors. One is workforce, other one is health data. So improving the collection, the sharing, the use of health data is, of course, an important way to improve care, reduce inefficiencies, limit errors as well. And we know that, I was describing some of the demographic realities of Canada with our aging population. That also means more patients with complex needs. And it makes the circulation of data particularly important when you rely on several specialists to treat you and several of the conditions that you face. Of course, you need the data to flow, so to reduce the risk of errors and inefficiencies and to increase patient safety. So what I would say, and I was fortunate to be in Paris last week for an OECD health meeting, and what I've noted is, fair enough, I think some OECD countries are ahead of us when it comes to data sharing, especially data sharing with patients and with healthcare providers. But few countries actually manage to harness the full potential of health data in terms of innovation, having a truly learning health system, and using all of the potential that data has to offer. So health data, as I mentioned, has been identified as a central element of the plan. So the plan was announced in February, but I think it's important to note that a lot of work preceded it. A pan-Canadian health data strategy was developed before the plan was announced, which a lot of the components of the plan draw inspiration from. And so that has allowed us to make a lot of early progress on implementation of the plan. So beyond the bilateral agreement component of the plan, which is, evolving at a good pace, we are seeing also some progress on the health data commitments specifically. And just to maybe explain a little bit, what those health data commitments are, they are related to the adoption of common standards and policies among FPT governments. They are related to interoperability. They are related to the sharing of public health data, learning from the pandemic, of course, and other components. So what we have observed over the last few months is a few key successes, namely with the endorsement of a joint FPT action plan on health data and digital health, which was adopted by ministers last month, and which includes a commitment to sharing data and reporting on common health indicators. So we know that, well, if you've been following the plan a little bit, there are 8 headline indicators that are, being reported on, will be reported on systematically over the next, over the whole duration of implementation of the plan. There's an initial report that was published by CIHI, which provides a snapshot of where these indicators stand at present. There are more indicators being developed. So indicators, common indicators, so that we can track progress. Adoption of common standards through the shared pan-Canadian interoperability roadmap, under the capable leadership of Infoway. So that's going to be a key area of focus, FPT, of our FPT work moving forward. Policy alignment with initial focus on health data stewardship for secondary use. Public trust and data literacy, we know remains an issue. We still have, there are Canadians who, are concerned about the sharing of their health data. And I think it's important to be clear about, how we intend to use the data, that it's meant to be used for public good, and data literacy, because a lot of Canadians don't feel confident, accessing their data through these systems. There are like specific segments of population that we need to focus on. And the collection and sharing of public health data. So those are some of the areas on which FPT collaboration will focus over the coming years. And a second key milestone that we reached is the adoption of a pan-Canadian health data charter, which is essentially a document that you can find online, actually, if you're interested, a document that highlights the key principles that will guide our work as we advance these efforts. So it outlines 10 guiding principles that really put people and populations at the core of all decisions about the disclosure, access, and use of health data. It also highlights the importance of promoting and preserving Indigenous data sovereignty. One of the specificities of Canada, if you look at other OECD countries, it's something we have to be very mindful of in our context. And so as we innovate and modernize our system, we have to keep in mind other elements, such as equity, has to remain a central value. We cannot leave behind segments of the populations that are already marginalized. So, the potential of data should not leave anyone behind. Privacy, I mentioned already, we'll need to continue reassuring Canadians and just, making sure that we have standards in place to make sure that we do protect the privacy of Canadians as we share their data for public good and for innovation. And, the last key milestone that I'll highlight is on interoperability, and Infoway will be able to speak to this in more detail. But we have seen the endorsement of an interoperability roadmap by FPT governments earlier this year, and the roadmap is currently being implemented. It really sets the path forward for achieving a more connected health system through the adoption of common data standards. And as federal government, we were looking at ways of driving this progress and encouraging its acceleration. So we're currently looking at a potential federal legislation that will focus on health IT vendors, requiring them to adopt common standards and prohibiting data blocking. So this would, of course, align Canada with other international markets, such as the US and the EU, who've already implemented similar legislation. So I'll leave it at that in terms of progress on the Working Together plan. And before turning to the next speakers, maybe I'll just reiterate the importance of how important we think that the role of the private sector is in working together. I think when we say working together, it's federal, provincial, and territorial governments, but it is also it is also the private sector who can help us really drive innovation and transform our health system at the pace that is required. So I'll stop here. Thank you, Kathy.
Thank you so much for that update. I think it was very, very helpful to set the stage for everybody and give a broad overall picture. So maybe with that, I'll turn it over to you, Michael.
Okay, well, thank you. And thanks, Emmanuelle, for setting the stage. And so I'd like to think about interoperability is not a very kind of nice word, very complex, difficult to understand. But in the end, it's really about connected care. And, I think that, we certainly look a lot at what does go on in other countries. And Canada's not the worst, we're not the best, but we're kind of middle of the pack. And in some areas, we've done better than other countries. But, there's a lot to do. And I think one of the success factors initially is the leadership. And I think the great thing is that, since COVID occurred, I think policymakers, politicians openly now realize that, the system has got to become modernized and we've got to get rid of those old fax machines and paper at some stage if we really want to go forward. And in particular with issues like human health resources and everything, burnout and so on, obviously, more efficient workflow is going to really help patients access care more effectively, but also the providers, provide the care. And in a way, having worked in technology for years, it's a shame to see providers talking about digital burnout. And I like to think it's kind of payback time in a way that, doctors, nurses, other healthcare professionals have spent a lot of time populating these EMRs and EHRs. Now they want to see a return on that investment. And usually technology should make your life easier, not harder. And I think it's up to everyone, including industry, to really find, the solutions here. Now, of course, as we know, Canada is also a fragmented system. We don't have a single health system. We have 13 different health systems. And that always is a challenge. And in the end, you can't work in a random way. And I think that one of the values perhaps that we can bring to the party really is the fact that although we're a relatively small organization in the scale of things, I think what we're challenged to do is to bring a kind of unified approach, a pan-Canadian approach. And when we look at areas like standards that Emmanuelle has talked about, and one of the key issues really, I think, is that, we're familiar that a lot of investment is going into hospital information systems, Epic, Cerner, Meditech, hundreds of millions of dollars across Canada. And, generally speaking, I think hospital systems are becoming much more adept at introducing these systems and improving their clinical workflow. And this is the challenge they face. Once they've implemented the systems, how do they really get to the core improvements for their systems? On the other hand, we have the primary care field, and we know there is a kind of shortage of primary care resources out there. And, by its nature, primary care kind of built up from a privately provided single practitioner kind of environment where you don't tend to have CIOs and sophisticated IT departments. And there is a move more to group practices and so on, and more kind of extensive ambulatory care solutions. And those things need to be really supported, obviously, electronically. And, I think the points that Emmanuelle mentioned about the 8 different indicators that are going to be measured, 2 of which were kind of put in our court. And one was allowing Canadians to access their electronic health records through a platform of their choice. And the other one is enabling healthcare providers across all settings to exchange patients' health information electronically. And so the key goal is to connect these EMRs in the doctor's offices that have largely come from small Canadian companies. And it's like this in virtually every country. Primary care physicians systems tend to be locally, come from local innovations, whereas the hospital systems are more multinational companies. And so what we're trying to do is to come up with a standards framework. And going back, you can't do it randomly. And so we unveiled this 10-year shared pan-Canadian interoperability roadmap, which contains a number of different steps that need to be put in place to standardize that data exchange across the different environments. And there's roles in there for providers, for the ministries, for healthcare, IT professionals, for industry to all kind of work together. And one of the key things we wanted to do also was make sure that we use international standards wherever possible, because we also recognize that companies are not want to invest too much bespoke work to come into the Canadian marketplace. You know, it's going to be a lot easier if we can do this on an international basis. And then also we're looking at new standards like FHIR and so on that can be applied perhaps with a minimal amount of code changes to the basic code structure of some of these solutions. So it's a very kind of complex area, but needs to be tackled in a systematic way. It's a 10-year roadmap. Obviously, we hope we're going to get you know, a lot more kind of results in the interim as we implement it. As Emmanuelle said, each province territory, we work together with all of the PTs on the plan, and they each signed off on the plan at the beginning of the fiscal year. And now we're in the process of actually coming up with customized programs which kind of complement these bilateral agreements, because we recognize obviously a big province like Ontario is going to have different issues from a territory and so on. And so we try and customize a program across the country. And within Infoway, we have a number of subject matter experts in standards, in cybersecurity, in kind of digital workflow and clinical workflow and so on. And so we also play a big role in convening different groups of stakeholders to bring them together to kind of gain alignment on these different areas. And, you know, and certainly private sector are a big part of that process. We're kind of really looking at building a private sector kind of partnership with industry to help drive the standards and to identify new kind of solutions that will be, you know, help drive this objective forward. And the kind of goals we're looking at, you know, one is in the area mentioned by Emmanuelle about data blocking and easing portability of data. You know, I honestly think that most companies do really fully accept that the success of their programs is to have a good interoperable system, and they can exchange information with competitive systems, because in the end that will really allow their solutions to, you know, excel within the marketplace if they are very interoperable. But it also does need some coordination to put that in place, and also perhaps some legislation to kind of mandate that some of these standards are followed. The next one is really looking at the provider access to kind of ensure that if you're a family physician in a remote location, you can get the patient's information at the point of care, and also you're able to exchange the information. And we're looking at some of the common things like e-prescribing, for example. We support a national solution in that area, but we're looking at e-booking, e-referral, other kind of collaborative areas as well. And then, of course, enabling patients to access their health record. And, you know, I think we're seeing a big kind of increase and uptake in this area. And last week, in fact, there was an announcement in Nova Scotia that they've kind of rolling out the Maple solution across the province to help bridge the gap between those Nova Scotians that don't have routine access to a family physician. So it's really good to see an example of a public-private partnership in that kind of respect, actually providing solutions for the population. And then part of it is also to kind of help people triage themselves so that they can select the best kind of solution, not necessarily race to the emergency room every time something goes wrong, but able to kind of coordinate their own care effectively and their caregivers as well. And so there's a tremendous amount of work going on, you know, in terms of bringing all these different tables together, working on a kind of systematic program, and then also working with other partners such as David's organization. And I know in a couple of minutes, David's going to explain how his role kind of fits into the data side of the equation. So I think we're going to cover some of the other areas on the discussion, but that's the kind of update for now. And then I'll hand over to David. Oh, sorry, I should.
No, well, that's a perfect segue. So to round out this first block, which is on the situation in Canada, over to you, David.
Thanks very much. So the good news is there's not much for me to add to like, that's been fantastic context setting. Just perhaps a slightly different, why are we interested in this? I practiced this at the dinner table, right? When you start talking about standards and interoperability, it's a like loser right across the board, like eyes glaze over. And so all of this is about health information and health data in support of the principles in the Health Canada, and like in the Health Act, the federal legislation that says what we should be aspiring to as a country is equitable access to safe, high quality care delivered in a person-centric and designed in a person-centric way. That's why we're all engaged in FPT conversations and negotiations and technical discussions with private sector as well as public sector, and trying to herd the provinces and territories to adopt common definitions of things, because it will improve health outcomes. And the corollary of that is, in the absence of agreement on those principles and some sort of a consensus around a roadmap around those things, we're actually causing harm. Harm at the personal level, harm at the system level, and harm in a public health sense. Different kinds of harms. You're breaching health privacy legislation. You're actually causing a physician. So just think about the complexity of an individual who's admitted into an acute care setting with a complex set of conditions that require lab tests, diagnostics of various kinds, 3 or 4. The inability to link data in a standardized fashion means that the chances are that that physician and that patient are not going to get the benefit of timely, accurate information delivered in a reliable fashion, and it could cause them harm physically or emotionally. Other kinds of harm include breaches of privacy legislation. Other kinds of harm are cultural. At a system level, information is not available to foster innovation in a pharmaceutical setting or the development of medical device setting. So in addition to the principles, we have to acknowledge, we're in fact in thinking about developing an indicator for harm caused by lack of access to information, health information, or lack of access to high quality, accurate information. Because if you talk to clinicians across the world, including in this country, they can point to instances where they didn't get the information that led to harm for a patient. That's why this stuff matters. It's improved outcomes, improved healthcare delivery at the coalface for individual patients. And I think the discussions with private sector entities are absolutely necessary, organizations such as many of the people in this room, at a principles level, which is why I think the charter that Emmanuelle mentioned is so important for you folks to take a look at. Because if we could stack hands around the principles that we would adopt on a consensus basis as a group of willing partners around the use, acquisition, provision of health data, it would actually continue to push the provinces and territories beyond some of their more parochial interests into some of the areas where the country needs to go, but would also provide a backstop for those moments when, but FPT relations disintegrate or fall apart for whatever reason, and we can't afford to lose momentum between public and private institutions in the forays we're making into this area.
Thank you very much. Very insightful. The second portion of our discussion is really focused on these international inspirations. So Brigitte, perhaps you could kick it off by talking to us about some global best practices of public-private collaborations.
Yeah, I'm happy to start us off. I don't think I'm the only one that's going to talk this through, but maybe the first thing I will point you to is tent cards on your table. And I think electronically as well, there's a QR code on those tent cards, which is to a report that we sponsored in 2022 that looked at European readiness, so we looked at the EU countries and the UK, and really looked to what were we seeing in this space, the secondary use of health data, which perhaps we can come back to. And what were we seeing? What were the indicators that would tell us a country's readiness, and where would we heat map all of the countries? And so I just encourage you to take a look if you're interested. I'll share a few examples, but I think there's much more detail there. And to support what Emmanuelle said earlier, I think what you'll see is a number of countries that are in different places on the readiness scale. And there is no perfect healthcare system in this world. And so the question becomes, what's the right thing for Canada to do and for the different jurisdictions to do here? There are things that can inspire us. There are countries that can inspire us, but at the end of the day, we have to be able to do what's right for the country and for the federation that we have. What I would encourage us to think about is that, as opposed to thinking about our federation as something that is difficult for us to then pull together, the question becomes, how does the federation, how does thinking about a data federation actually move us forward? Because the diversity and the richness and the thoughtfulness of our data, you cannot argue against. Canada has really strong research, really strong clinicians, really strong academic institutions. And I think what we've just heard from our three partners here to my left is when you put that information together, there is a lot of information that will save lives. And it's about how health data saves lives and how we bring it together to give us the absolute possible chance at the outcomes you were talking about, David. So when I think about the different countries, I suppose it depends what we want to look at and what inspires us. I love the idea of a charter. I love that you are giving us guidance in terms of what can we all be moving towards, because the concept of standards is where Europe is going. So there's European countries and then there's the EU, and they are working together on common standards. They're working together on interoperability. Their ultimate objective as an EU is to share information across 27 countries. So if they can do it, we can certainly do it across 14 jurisdictions, because I include the federal level as one of the important data jurisdictions as well. I think some of the countries that inspire me, again, depending on what you're looking at, is Denmark is a great example, Finland, Belgium, maybe to hone in on. Denmark, to the extent that it has really thought about their health data authority. Smaller country, maybe more akin to one of our provinces, but a smaller country, but with that kind of centralized health data authority, where they have a culture of trusting the information and of sharing their information. And all of this, I said before, is the secondary use of health data. And I think that's really important for us to hone in on as well. So what we're talking about are countries that are moving. Primary data is my data, my watch, my data, my information that I give to my GP. That information is then aggregated and it becomes secondary use. And it's the secondary use that then gets aggregated into public health decisions, that helps government make investment decisions, that helps research-based companies think about where the right next wave of research should go, that would help universities and health researchers in those settings, and so on and so forth. So what the EU is really focused on in European countries is a secondary use of health data, how you make that safe, how you think about partnerships in that space. And Denmark is a great space for that health authority, and you can bring research questions forward. You can work in that space between the public sector and the private sector. And there's a real understanding of what you're trying to achieve and the questions that you're asking. Finland is another great country to look at, to be inspired, I think, from a legislative perspective, mainly, and how they do public engagement. So Finland has really strong and thoughtful legislation. They've been at this for a long time. And so they've really updated around privacy. They've had good legislation that looks at how you can think through not only data security, but how you think through the use in clinical practice and in research practice. So I know, for example, that Latvia and Estonia basically went and visited Finland and took their legislation and then went home and readapted it. So I think there's something there for us not to reinvent the wheel, but look for that inspiration and see where it goes. The other thing I think Finland did really well, which we can also talk about because it was alluded to, is how the public setting, how all of us as individuals are, how our information is stored and how that public engagement takes place. We have to have trust in the systems that are going to be pulled together. And what Finland did really well was create a few different tables. One was called Sitra, S-I-T-R-A. And they actually ran consultations for the EU, and we were a member of those tables. And it brought together public sector, private sector, not-for-profit, patient organizations. And we talked about, we were then divided into different tables on different topics that were important to the EU countries. And we worked through some practical ideas of how we could help. Public engagement was one of the tables. How do we help create confidence in data security? And that was something Finland, I think, had a few learnings. And in the sense of a learning organization, Finland went through some learnings around data security, and then they've been able to update their legislation. So I think we could really be inspired there. And Belgium maybe is the last one that I touch on before turning it to Sarah, but really thinking about, again, a health data agency that they are putting in place now, really looking at research questions. So how do we work together? How do they aggregate their health data registries, bring them all together? And then when you have a research question, so in our case, as a pharmaceutical company, we certainly have research that we want to be able to partner in the country to be able to do at the academic institutions and to be able to move our clinical work forward. And so we're able to go to the agency with the questions that we have around research, and then they go through their categories and elements that are important in their version of a charter, their principles, and then we're able to move forward on research questions together. I think we can probably learn a lot from those different places, but the common themes there are really the public-private partnership that we've heard about, the concept of really getting a good legislative framework ready, thinking about privacy and thinking about interoperability, and then never forgetting that we have the public engagement element that's important, so we all have confidence in the systems that we're pulling together. So hopefully that helps just set the stage a little bit in terms of where we can be inspired. But I would also, I suppose, leave you with, we can still move forward and learn and teach them some things too. So I think the fact that that we have these three colleagues here and that we want to move into that position and really move forward, I just think, let's be inspired, but let's understand Canada will have to do things a little differently, and let's move with urgency, because I think we can get this done quite quickly. And then we'd be in this position of being able to help other countries understand how to go forward.
Merci beaucoup, Brigitte. Over to you now, Sarah, to discuss some examples that you think are worthwhile looking at.
Sure, absolutely. And I couldn't agree more with what Brigitte shared to set the stage for this. This is clearly an important topic, and there are perspectives, diverse perspectives and capabilities across the public and private sectors that ultimately need to come together for us to address the complexity of the challenge in front of us. And so maybe what I can do is share a few examples building on what Brigitte shared about secondary uses of data and getting to that point of making full use of data to have improvements ultimately in healthcare and equitable healthcare. So one example that comes to mind, drawing from kind of what's happening in Europe, is in France, the Health Data Hub, which includes a rich claims database and secure data platform representing health claims for, I think, over 99% of the French population, and examples of collaboration with the private sector to extend and enrich what's possible with this data. One example that comes to mind, working with the France Health Data Hub, as well as academia, universities, pharma, ourselves, to be able to answer questions about rare diseases that were previously just not possible with the data we had. So one example being a very heterogeneous rare lung disease, actually now really being able to advance forward based on having this data foundation available. It's still early days, but I think there are other examples that have emerged. I heard the Chief Scientific Officer for the Health Data Hub share another example of a startup company, a medical device company with real-time pacemaker data, but not necessarily a view of what would happen to patients after a particular sequence or event in the data. And by being able to, in the secure platform, in the secure trusted environment, use deep learning to actually build on the claims data, really build out an ability to determine the risk of cardiac complication. And so it's an example of the type of innovation that can emerge when we have the foundation for this type of collaboration. I think we can also look to the UK. HDR UK as an example, a consortium model dedicated to a lot of advocacy in open access to data to drive advancements in healthcare. We launched the Data Can for improvements in cancer care through site-based analytics, benchmarking and research in collaboration with HDR UK. And very similar, in fact, to the Oncology Evidence Network in Europe, which actually spans multiple countries, launched in partnership with universities to improve the quality and cost effectiveness of cancer care based on patients' individual needs, leveraging capabilities at the sites to ready the data, to protect the data from a privacy standpoint, so that those secondary uses of data can truly make the difference that we know they can. And it's exciting to see what's happening with the European health data space, because coming back to the France Health Data Hub, it's one of multiple secure platforms in a network that will elevate the capabilities across multiple countries, and where we can look to for examples of what might be possible in Canada. And I think building on, where our federated model can actually be an advantage. So we see examples where we have the data, meaningful fit for purpose data, what impact that can make. For example, working with a health system, in this case in the US, being able to screen more than 50% more patients based on social determinants of health. Or with the NHS in the UK, actually reducing the incidence of stroke by 22% due to atrial fibrillation. And so the key challenge, there's probably too many examples to sort of speak to, but the key challenge across them all is getting to that meaningful data, because the volume is not the challenge. We have huge volumes of health data increasing every day, but it's actually quite complex, collected across so many different points for different purposes. How do we bring this data together, integrate it, connect it, so that we can have very meaningful information to answer difficult questions? And I think the last example of collaboration that I'll speak to is where actually capabilities that have been proven are being leveraged to actually establish the data foundation we need for secondary uses of data. A good example in the US government for military healthcare, which is actually at quite significant scale, over 400 clinical sites globally. So a lot of different points of collection in health systems, and a desire to actually make better use of this data for research, for important decisions. And in this model, leveraging a lot of the accelerators, the capabilities that we have to curate the data, integrate the data, map the data to open standards like OMOP, and actually using the innovations that have been proven across different sectors to establish that basis for being able to drive ultimate improvements in care. And so as I think about this, it's a really interesting time. I'm very excited about the conversation today, the momentum. I think we're at a juncture where technology is not the barrier in front of us. We have the tools at our disposal. Really, the key challenges are more of the organizational communication, engagement aspects, having a framework where stakeholders are aligned across sectors and incentivized to move forward toward the outcomes we're all looking for. So I think it is an exciting time and really important issues to be tackled.
Excellent. Thank you so much for those examples. Extremely interesting. So the last portion before we go to the Q&A is really several of you have referred to, we can't copy and paste necessarily these solutions. Brigitte, I like very much when you sort of said, well, maybe we can even go beyond what others are doing, and so they can come here and learn from us. So the question really is, based on, and this is to everybody on the panel, based on what we heard is being done elsewhere, What do we think could be some of the priorities or things that Canada should be doing based on these examples? And in that, I would really include the whole social acceptability of the digital transformation. So I throw this out, and whoever feels that they would like to dive a little bit deeper on what some of these international ideas or inspirations could mean for Canada moving forward. Yes.
Get it out of the way early. So I was really, really taken by what you said, Sarah, because, you know, we're a secondary use organization. We hold administrative data. So we're thinking about what's it going to take for us to remain relevant in an AI world in 5 years? How should we be working with you, the research community? And it seems to me, and it will come back to your point, I think I've got a colleague, Ewan Affleck, who you folks may know, who speaks about the challenge of human interoperability, not technical interoperability. And I actually think it captures it tremendously well. That's what we should be focusing on as a group of organizations, both public and private sector. And to me, the public engagement, public literacy, like improving the data literacy of Canadians, I think as well. I think they'd be shocked at what they think is happening isn't really happening with respect to exchange of information and data across providers and provider settings. Sometimes I think that they just assume it's happening and they're really taken aback when they aren't. And when you think about the impact of wearables in things like a long-term care setting and how that could be used to help mitigate the health human resource problem by gathering data appropriately, using it for care planning, using it to deliver care. I do think that coming to some sort of agreement around a set of principles about how we'll behave with respect to health data, and then including the public in that as well, would be a really important first step. It goes hand in hand with the legislation, I think, Emmanuelle, but we need to extend this into civil society in a way which sort of transcends or complements legislative actions as well.
I'd like to just jump on that if that's possible. I think what I hear us saying is there might be a lack of clarity as to what's expected of all of us. And I agree with you that we have the technology, we have a lot of different systems, but the technology is out there to attach these systems together as long as we're collecting same information, the right standardized information, and we're able to share it across borders. I think that concept of what are we all expecting of each other? And if we can bring that clarity in terms of the principles, but also guidance, what you need from us, how we need to move forward. And I think that's what other countries are doing well, is that they have a very clear legislative framework, principles framework, policy framework, and people and organizations follow those standards. And I think we need to get to that place of rigorous thinking and application. And it comes with time. I think that the concept of literacy, and we all have to learn here. And if we do want a learning healthcare system or a set of learning healthcare systems, then we're going to have to work together on it as well. So I think that could be really interesting. I would also point out that many of us have experience with our clinical research and our clinical trials. We're already using wearables in our trials. We're already using iPads. You go home with your iPads as a patient and you have to put in your information. We're collecting information. We have patient support programs in Canada that other countries do not have, for better or worse. And so we have these patient support programs that are collecting information, and we don't even think as well as we could about how that secondary use of that information could be thought through and supporting other decisions that have to be made. And so I know we're all having discussions as a sector and as industry, how might we think about this information, and working with IQVIA, working with McKesson and some of the other private sector companies, how can this information be more thoughtful, and how can we share it in the right way to be able to make decisions around the reimbursement of medicines and technologies, and how hospitals should adapt and should perhaps rethink their processes for new technologies that are coming to be adopted and to have a smoother path for patients. So I think you're right. I think you're both right. It comes down to how do we think as human beings, and what guidance can we all put together and follow that makes it just a little bit more standardized. Not a little bit, that makes it more standardized in order for us to be able to advance.
Thank you. Emmanuelle?
Sure, thanks. Yes, Absolutely. There is a lot we can learn from other countries and frankly, from examples here in Canada. One of the advantages of having a federation is that we have a diversity of models being implemented across the country. So we need to also learn from those. But, you know, what I will say is we've had, as you can imagine, several conversations with a variety of international players as we developed the framework for the plan, including some of the examples that Brigitte gave. You know, I have a very good relationship with my Danish colleagues. We spoke to the Finns as well, and the Americans, obviously, the Germans. And, you know, obviously, the idea of the legislation in part comes from there because, you know, the EU and the US do have a pretty clear legislative framework when it comes to interoperability. But we also knew we couldn't apply a cookie cutter approach, you know, and just take their legislation and apply it in Canada because, well, first of all, the context in which they adopted their legislation was quite different. In the case of the US, it was during a financial crisis. They wanted to, you know, boost the economy. So, you know, they took a different approach. And we have to look at our context as well in terms of being a federation. So the approach we're looking at in the context of the legislation is a very collaborative approach with provinces and territories, recognizing the fact that some of them have already adopted an interoperability legislation. So we don't want, you know, if they have a legislation that is substantially similar to what we, you know, are thinking of implementing at the federal level, we don't want to displace that. You know, the idea that we think would make more sense is a backstop approach where, you know, if you don't have such a legislation in place, you know, then, you know, the federal legislation kicks in. But if you do, and if it's, you know, aligned with the federal standards, then, you know, we're good. And we looked at various other elements of the other countries' experiences, including something that really came out of those international consultations is you need to look at the whole ecosystem, right? It's, yes, a legislation is good, but then what kind of support will the providers need? We talk about literacy in terms of individual Canadians, but, you know, this is an adjustment for providers as well. It will be an adjustment. So do they need, you know, support literacy or other? Enforcement mechanisms. You know, we discussed equity at length as well. This is an issue that, you know, is very important to the government of Canada. And, you know, we were talking about indicator development earlier, but, you know, one of the things that we didn't have the chance to mention is we are making sure that the data is disaggregated so that under a percentage, you know, that can, you know, make us look good or not, we can see, you know, the underlying, you know, okay, we're at whatever, you know, 84%, but is there one group who's at 54%? Well, we need to know that, right? And finally, I will just maybe add that one of the silver linings of not being the first to do that is that we have international standards in place that we can use. When the US adopted their legislation, you know, some of those international standards did not exist. So we have the benefit of, you know, being able to rely on, you know, these existing standards that will align us with, you know, with other countries and that have been refined over the years. And maybe I'll just add, you know, two specific examples of initiatives that we are looking at more closely working with CIHI and Infoway. First of all is the US Technical Exchange Framework and Common Agreement, which basically is a framework that makes it easier to share and access data once standardized. So we're looking at, you know, developing our own Canadian version of this framework. The EU also has its general data protection regulation that is, you know, that can also be used as a model for Canada to, you know, develop something similar. So we are looking at, you know, what other countries have created in terms of frameworks and policies and drawing inspiration from this.
Thank you. Sarah.
Well, maybe I'll just build on, I think some really good points already highlighted. And when it comes to the literacy challenge and the engagement of the public at large, which is a really important aspect to this, I think it's actually quite favorable for us to see a lot of what's happening in the European health data space come to the foreground in terms of actual debates that are taking place that we can learn from about the risks of sharing data, but also balance with the risks of not sharing data. And I think this is so important that as we look at critical issues and concerns, for example, related to privacy, that we're having these discussions in the context of why data is being used to begin with, so that we can bring forward a balanced perspective. And I think one of the things that's actually really important on this topic of equity and privacy, it's so important that we have data that's representative of all Canadians and not just individuals that might enroll in clinical studies, as an example, because that's the only way we're really going to understand social determinants of health, make improvements in population health management, make decisions that are representative of all Canadians, including groups that have traditionally been marginalized or with less equitable access to care. And privacy enhancing techniques, methodologies, technologies are so important to this because they empower population-wide data to be safely used without at any point ever revealing individual health information along that chain. So I think all of this is important, and we can certainly look to a lot of the public discourse that's happening around the European health data space.
Any other points? Yes.
Do you want to get Michael?
No.
Okay. I think matters related to privacy, health, privacy, and confidentiality are so culturally based. Like they grow up in an organic fashion in the jurisdictions in which, like, so the GDPR the GDPR right now grew up is a product of the EU culture over the last 50 years, 40 years. And for those organizations who have an interest in promoting and disseminating AI solutions in the healthcare space, it's not a framework they're like wild about, right? And so there's a whole discussion going on between, is there a G7 model versus a GDPR model that's cultivated out of the collective experience of the UK, the US, Canada, Australia, New Zealand, that provides a different path or a different way of navigating those same challenges. And so that's why the discussion about health data and the principles that govern access to health data, its use, the covenants around it, to me, it's almost a 95% fit with the AI discussion. And it's about governance. It's about that human interoperability stuff.
Thank you very much. We've had a great exchange. I'd really like to give people the opportunity to ask our panelists questions. So if you have any questions, there are some mics. Please go to the mic, state your name, and ask your question. It's okay. We can probably hear you, but for recording purposes, it's useful.
So thank you very much. So the one question I'm really interested in, and you talked a lot about the human interaction of all of this data, right? So this might get down into the little weeds, but when you think about the regulators of health human resources, so the pharmacists, the physicians, how are those discussions going? Because I would think, we have 13, 14 different regulators out there that are extremely important. And I'll give you one example. When you look at the pharmacy space, what's very interesting is, online adjudication, for instance, on the claim side is almost impossible these days. It seems like it's getting developed, it's working on, but anybody who wants to tackle that on the panel, that'd be great. And sorry, my name is Ivan Rosrana, and I'm from Diplomat Consulting. So thanks very much.
Anybody would like to tackle that?
I can to a degree. I don't know if I give a decent answer, but yeah, certainly, the colleges, the regulators are important players, and every province will have their own set of regulators. We've had quite a lot of experience, particularly in the pharmacy space, because we operate an e-prescribing platform, and we've really had to have the agreement of the regulators in each province, which can be an accelerator or a stop point as well. And so I think that we have to be very kind of sensitive to the regulator requirements. And there's a lot of discussion now about kind of trying to move towards more pan-Canadian kind of approaches. The way that we try and tackle it is that we have several I mentioned earlier, we convene several different tables in different speciality areas. And so, that's the way we try and look at it. And for example, in the privacy and security area, we are actually looking at a trust exchange framework that would really, have the guidelines for sharing information, what can be shared and who gets access to what and so on. And that, again, is a big collaborative effort with a lot of different players. And I'd like to think that, we can work with the regulators and try and, again, come up with kind of, pan-Canadian standards where possible. And, and I think the regulators obviously do a good job, but we want to ensure that it's not going to slow everybody down, but we have to be mindful of the structure that we work under.
So our view on that and how one works with the regulators, the regulating community across the country, it's being inflected by our experience now. We've been asked by the federal government and the provinces and territories to establish a center of excellence for health workforce, which at some point will reside on its own independently of CIHI. And the discussions around with the regulators is about workforce, access to workforce. And when you think about the scopes of practice discussion that's going on in different jurisdictions, I think Ontario just announced a different set of changed scope of practice for nurses today, where they have prescribing rights now over some medications. So our way into discussions with the regulators, like there's so many facets to it that I think we have to establish a pattern and a habit of actually making progress together with them on specific issues and with particular focus. And so then we can get into the habit of saying yes and coming to agreement, as opposed to getting into the habit of continually being in a point of contention. And that's sort of how we're adopting it, but we're only one player in a very complex matrix for this stuff. Getting into the habit of agreeing as opposed to sitting on either side of a border, heaving rocks at each other is actually important.
Emmanuelle.
Very, very briefly. So, I mentioned that as part of the working together plan, there are two key areas for joint work between federal, provincial, and territorial governments. And I focused, of course, on health data because that's the topic of today's panel. But there is a second component, area of collaboration on health workforce. And the focus of that work is really on labor mobility and recognition of foreign credentials within Canada. So my colleague who's in charge of that is definitely having those conversations with the regulators. On our side, on the health data component, we are not having specific discussion with all of the regulator organizations because there are so many of them, but definitely with providers as a whole, and in particular on the legislation. And I must say that reaction overall and through all of the engagement, so not just with regulators, but also with IT vendors and provinces and territories, has been very positive so far. Here and there we'll hear comments about, but we'll need support, or we'll need, training, or, change management support. But overall, I think there's a general recognition that this is needed by everyone, and that these efforts are going in the right direction.
Thank you. Any other questions in the room? Yes, Bill.
Thanks, Kathy. Hi, Bill Dempster at 360 Public Affairs. This was excellent. I'm just wondering, a lot of people probably have either read or have it on their bookshelf, The Patient Will See You Now by Eric Topol. Do you see individuals and some of even the big multinationals facilitating the opportunity for them to get ahead of where you're going with their own health data? Thinking about Apple Health or Amazon, are you keeping an eye on some of these new systems where patients are just going to, own their own health data, go with it, hope that it actually operates in an interoperable way, and then hand it to their clinicians and say, this is my binder basically on my smartphone. Do you see that happening? And how do you keep an eye on that and keep up with it?
Go ahead.
Shall I start? So certainly, I do see that happening. And, I think, still when you look at healthcare, it's a kind of paternalistic kind of system. The patient revolves around the doctor and so on. So, I think that the Topple book is very kind of, apt to that discussion. And, the power of AI that's coming, everybody or a lot of people use WebMD when they look up something initially in different resources, Google Health or whatever. I think certainly putting the power in the patient's hands is going to be a transformational thing to do. And you only have to look at other industries, where you think most industries have been transformed by consumer power. And a good example is the banking system. Years ago, you had to really kind of doff your hat to get a meeting with the bank manager. Now, banking is very accessible and you use different platforms to control it. I think the other thing is, can you regulate it? Because, when you look at health apps, I mean, I can go and perhaps get a second opinion from Cleveland Clinic or any health facility around the world. I don't just have to be constrained to Canadian resources. But I do think it's a really positive development to see the democratization of healthcare. And ultimately, we all know the way things are going, there's never going to be enough professionals, never enough doctors, nurses, other healthcare professionals. No matter what we do, the demand is outstripping the ability to provide those services. So perhaps for all of us in the future, our iPhone will be the first port of call to get into the system. And you can see that with regulation, how far can that go? AI prescribing drugs on protocols that have been, tested by the FDA, Health Canada, whatever. So I think it's a really good development that will cause some big change in the system, turn it on its head.
I'd actually be talking to Loblaws. That's what I'd be talking to in the Canadian context right now. But I think there is a risk that personal adoption of wearables and those things or different device things in your own home that can be used. Like if we think about aging in place, is there a list of things you could invest in your house that would allow you to live longer, safer in your house before you have to go off to a retirement facility, or that would actually generate data that could be fed to a care provider or to an EMS unit or something to you that would allow you to develop patterns of living in a home that were safer and allow you to extend your life there? So I do think that there is a risk that personal adoption and the evolution of technology will outstrip any capacity to regulate it in a legislative sense, which is why I think a principles-based approach to these things, so get Medtronic, get the device manufacturers, get the individuals around a table for a discussion about, because part of this is building trust as well. I mean, I do think Amazon's doing that. Do I trust what they're doing with my data? So, I mean, that's part of the same conversation. And so if you want to be in this game, I would advocate for the establishment of a set of principles that private sector entities work on, and then we build public trust together that somebody's not going to have their data used for purposes for which they would not approve it.
Add from more of a patient perspective is, depending on the country in which you live, I had an experience where, first of all, the data is mine. I'm the patient. This is my information, and it's my information going into the health system. And I've given it approval to go into that health system for the purposes that I understand it's meant to be used for. And so no matter where I went in Belgium, if I was with my GP or my specialist or in the hospital system, my information was following me. I didn't have to fill out more forms. I didn't have to remember something and remember it incorrectly. I didn't have to worry about it here. I understood everything. I could look up my own tests. I could look up my own vaccine certificates. I could look up what I needed to do for myself, for my children, for my husband. And it came with us no matter where I was. And that's ultimately what we're trying to achieve from a health systems perspective, which is if I got sick today, hopefully not, on this panel in Ottawa, I could go to a hospital and my health card would look up my information, and I wouldn't have to try in a moment of distress to remember all the medications that I'm on and try to repeat it to an ER when it's all sitting in my Credit Valley Hospital accounts at the moment, at least for the most part. Even though I did have to fax in a referral at one point when I came back to Canada, which, by the way, my rheumatologist in Belgium refused to do because he doesn't have a fax machine. So I had to print off a copy, fly to Canada, get it faxed. So, I mean, this is what we're ultimately just trying to practically get to, is the information is mine. It is data that is from the patient. It is being given permission to be used for other purposes. Those purposes have to be clear. The system ultimately is about the information coming with me where I am so that I can get the best possible care in that moment when I need it. There are companies where we are partnering and having conversations with Loblaws and others because we want to understand how our information, how the patient support programs can evolve. How do we think about these informations? And I totally agree. I mean, we're a highly regulated industry. And so the clearer the guidance and the clearer the principles, then we're able to move forward. And I think that that's where the federal government and the provincial governments come in, is giving us those standards that we all must follow in order to have that really practical patient outcome oriented systems we want.
Sarah?
Yeah, no, I couldn't agree more with what's been shared. I think this is all part of what we're actually trying to do in keeping pace with how technology is allowing for advancements with patients taking ownership of their own data is something we have to have in view. Patients are central to the path forward, engagement of the public. And so I agree with what's been shared. And I think the principle-based suggestion is a really good one. I mean, we see some of the examples where data collected in one setting for a patient is regulated, but then from a wellness standpoint, it isn't. And you don't want to end up in those types of situations. So I think the framework and the principles are critically important for us to actually get to that patient outcome driven scenario that we're all working toward.
Yes.
Yeah, I'll just maybe add to what's already been said. Quebec recently adopted their legislation on health data, and I think the way they described it in French, they said, on ne veut plus que les Québécois soient les commis de l'État. So essentially, that you're responsible for, keeping track, like basically walking around with like your and your family's, health files, which I've done, having lived in like 8 different countries over the past 20 years. I have like stacks of paper this high, but having to do so within your own country or even within your own province, like it's not possible. I mean, some people, are, privileged enough to be able to, be very literate when it comes to their own health. But I mean, we have also to be mindful of the most vulnerable among us who maybe are not able to make sense of all of the data that's been accumulated on them over the years. So, access for patients, first step, of course, access for providers, essential, so that health providers can make well-informed decision, and then secondary use to build a truly learning health system, so that if we can learn from our mistakes and improve our system as years go by. In terms of models of consent, there are several different models, and I think from implied consent to, having to approve like every single person who can access your data. So the kind of model that, we will choose for Canada, I think will depend on a number of factors, but at the end of the day, it has to rely on trust. Like people need to know that their data is being used for their good. And if that trust is not in place, we won't be able to go very far.
Merci beaucoup. Any other questions? Yes.
Morning to the panel. I'm Brian Scott with ISED. My question really builds off of the previous conversation here, related around like trust and essentially what is privacy chills within the industry. We know that even if interoperability becomes the standard, which words we don't like to use here, right? putting two or more data sets together with disparate sets of data, one can be re-identified rather easily, whether it's from, your postal code, your phone number, medication prescriptions and such. How do we, on one hand, preserve the privacy of Canadians while unlocking this health data for the future innovations? Is it a combination, like we said, of a cultural change around noting that not sharing data is creating harms for the individual and the health system at large? Or is it also a legislative change within the privacy context to enshrine this same value within said legislation?
Sarah, go ahead.
Well, I think it's multiple things that need to ultimately happen. And actually, maybe I can point to the Goldacre report out of the UK, which was commissioned to look at how health data can be put to work more effectively in the NHS. And one of the major themes coming out of this is to get away from all the siloed pockets of data curation, preparation, approval to share data going different directions in these smaller pockets, and move to trusted environments with open access where analytics and the people come to the data doesn't go out. But critical to this, and I think it's alongside having the dialogue in the context of the balancing of different risks and benefits, is also having the right privacy mechanisms in place. And we're at a fortunate point in time, I think, that we do have a lot of privacy enhancing methodologies and technologies and tooling to use and I don't think it's a single one in isolation. I think it's a combination of multiple, building on this kind of idea of needing representative data across a population. As you bring data together, very important consideration, how do you ensure that these data don't become individually identifiable? And we can layer multiple privacy enhancing techniques into these trusted environments to be able to achieve that goal without hindering the path forward to actually start bringing the benefits from health data forward. So I think it is multiple things. It's having the dialogue in a balanced setting and framework of the risks that need to be managed, but also the risks of not moving. And then a combination of multiple layers of techniques and privacy protections so that we can bring data together, get to meaningful data, but also not along the process compromise any individual privacy. So I think we need a combination.
Thank you, Sarah. I think it was David and then.
Yeah, I didn't mean to be glib, but I absolutely agree. You need to do these things, and it's going to take a lot of time because we have developed a custodial. Again, this is from the report, the expert advisory group. And they themselves looked at 60 years of reporting about why we haven't made as much progress in these areas and so it's informative reading. We've got a custodial culture towards privacy and legislation. And so if I go into a acute care setting, the hospital feels that it's got a responsibility to make sure that my data isn't, then the lab that's taking my tests has to sequester that data and is reluctant to share it, unless it's faxed. Then exactly. And so if I'm getting if there are 4 or 5 dimensions to my care, because I've got a complex chronic condition, every one of those providers feels like it's their responsibility to protect my data, which means they're inhibited. They're not induced or inclined to share it. They think their public good is being realized when they protect my data. Don't share it. So that's the cultural impediment that we really have to get over, because we can talk theoretically about the fact that sharing data is actually in the greater public interest, and the things that Sarah identified are absolutely there to protect, to make it technically feasible to protect your data. Getting individuals to believe that their health data is as securely governed as their bank data is not where we're at right now. And that's where we need to get at.
I think the only thing I would add, first of all, I'm not sure how faxing information and letting it sit on a hospital ward is safer. So that's one point of view that I think we have to wrestle with. But what I was going to add to the end, because I don't think it's an or, I think it's an and, your question. And I would just, maybe others know better than I, but if we look to the EU and the EU health data space, their most recent adaptation was around privacy legislation. And this has been in place, I think since 2018, 17, 18, maybe the first round. And then they just updated it. And their learnings were 27 countries were interpreting GDPR differently. And within the country, to your point, every institution was then reinterpreting GDPR differently. And so I think the learning that we can come to is how might we learn all together at the same time with the same understanding so that we have the common principles across this important topic. And we're all understanding, I think your example, Emmanuelle, at the beginning, right? Why do I have to do the same MRI scan in 4 different settings? Why can't it be shared within the same setting so that we're not spending on the same exact duplicative steps and lab testings? And how can we get to a point where we become more efficient, safe and efficient with the system, and we're interpreting this legislation, the privacy considerations in the same way? I think that's what can inspire us from the EU.
Michael?
The only thing I would say on a slightly brighter note is that you don't have to fax MRIs, because in Ontario, you can I go to my family doctor, she can see every lab test, every MRI, every procedure I've had since I've been in Canada. And basically that information is shared and available. It may be a lot more difficult to share it between a province, but I think that, there are obviously a lot of issues that, certainly you go to a hospital, they should have your medication record, they should be able to pull up your lab results, whether or not you've had that test done in that hospital, anywhere else in the province, it's on the repository. So I think we do have that, although acknowledging the fact that there still is a lot of work to be done to ensure good exchange. One of the initiatives we're working on is the International Patient Summary, which is the standard that has been adopted in Europe. It's also a G20, a G7, and a WHO strategy as well. And part of the interoperability strategy is to kind of align this standard across Canada so that we actually have launched a Canadian version of the International Patient Summary. At the moment, Alberta and Ontario are both kind of early adopters, and our effort is to get the other provinces on board. And once that is adopted, you'll be able to share relevant health information, discharge reports, and so on when you go to another provider, just by simply giving them access to that file. So, I think those are the type of things that need to really be done to promote free and easy sharing. However, there still, I think, is a big issue in terms of anonymizing data and sharing it for research and other purposes, and public health as well, which, David's much more of an expert on than I am. Yeah.
And maybe just as a last note, and it's really like going back to what others have said, like we have to recognize, privacy and, by the way, cybersecurity as legitimate concerns, but we cannot let those considerations obliterate the risk of not moving forward and paralyze us. We need to, take stock of what those risks are, recognize that they're real and they're a real concern of Canadians, find ways of mitigating them, and then move forward. And as to protection of privacy, you're from ICID, right? Aren't you modernizing Pipeda? I don't know if you were hoping for me to mention it, but there are other, of course. Okay. But there are, of course, other initiatives across government to make sure that Canadians, maintain control of their personal data, not just in the health sector, but overall. So I think those are worth recognizing as well.
Thank you very much. Any last questions? Liam, you've got one from a virtual one. Go ahead.
So just relaying a question that came in from our chat. It's from Brigitte Buckingham of G Healthcare Canada, and it's for Miss Lamoureux. She asked this after your opening remarks, so I think you've touched on it quite a bit, but she was asking if you could share any further details on the federal health data legislation. So maybe if there are any other aspects you would like to speak about. She also asked if the legislation will be leveraging the Canadian Health Data Charter, or if it will go beyond the general principles outlined in the charter. And lastly, she asked if you're able to share any indications of when we might expect the legislation.
Let me get my crystal ball. Okay, I will share a bit more than what I did. At this stage, it is, of course, a proposed legislation. And we're at the stage of engagement. So we've engaged with provinces and territories, we've engaged with IT vendors, with health data providers, with a range, with FNIM representatives as well, so First Nations, Indigenous, and Métis representatives. So we are consulting because we want to make sure that we develop it in a collaborative way. Like, we want to make sure that it does not inadvertently, counter like existing efforts or is not aligned with existing efforts. As I mentioned, like, we've been pleasantly surprised by the reaction we've received so far. Generally extremely positive, and most comments are more about how can you help you do it faster than, oh, but we have this and this concern. Of course, the devil's always in the details. So there's a legislation, but there's also a regulatory aspect to the legislation. So we expect this might take a bit longer. I'm not going to, guesstimate, a date for the legislation to be tabled, but I think there's a certain degree of ambition to make it happen as fast as possible. But regulations, will be carefully crafted, in close cooperation and consultation with all of the stakeholders I mentioned to make sure that, we're all aligned. And just to go back, I think I mentioned that in my initial presentation, but the focus of the legislation per se is on IT vendors. So making sure that, they all use common standards when developing their IT solutions, and on prohibiting data blocking as well. So that's kind of the focus that we're envisaging at the moment. So I hope that helps answer the question. And how is it aligned with, well, the health data charter, of course, yes, the broad principles, the idea is to respect those broad principles. But I think the document that maybe is more relevant in this case is the interoperability roadmap, where, we're really looking at, the work led by Infoway to, in terms of standard development as a basis for the legislation.
Merci beaucoup. If there are no other questions, maybe I just give the panelists an opportunity for some closing remarks. If we were to be here next year, which hopefully we might repeat this event, what is it you'd like to be able to say or to see at an event like this?
Standards legislation, and actually 2 or 3 public events that have been co-sponsored by public and private organizations on engaging the public in the charter and principles discussion.
I think seeing the legislation and I think a sincere dialogue towards the clarity on the standards and clarity as to how to scale some of the learnings. I mean, we're doing a lot of public-private partnerships already in different provinces and different settings. I know we have our own that we're working through. How do we scale some of these so that we can take legislation and then make it very practical and demonstrate how it's having an impact and improving clinical care and patient outcomes? So how do we scale that? That would be a great place to be next year.
I certainly agree. I think today we had a discussion about examples we can draw inspiration from. If we could be here with the legislative framework, the standards, and examples we can point to with a reference for how those scale in the framework, that would be very powerful. So,
Michael?
Yeah, I think next year, hopefully having launched our roadmap, we're kind of deeply involved in a lot of the consultations and the kind of kickoff meetings and so on. So I think in a year's time, we should have some more tangible progress to kind of really look at, and in particular areas like the international patient summary and the access. When you look at patient access to health data pre-COVID, it was below 10%. 2021, it was up to 30%. And physician adoption is a similar kind of growth. So, the great thing would be to see a continued kind of trajectory in the growth of that area and much more experience in data sharing and outcomes to use as evidence going forward.
Thank you. And Emmanuelle, no pressure on the legislative front.
No, I mean, all of the above, right? Everything that was said. But in addition to this, what I would say is, in political science, there's this concept of flotilla, which is the idea that several groups of people with seemingly different interests and pursuing different objectives can, at some point in time, get together and work together to work towards a common objective, because it really, stars aligned at a certain point, and we all have a common interest in moving a specific agenda forward. So I guess my hope is, that by next year, our flotilla, hopefully including all of you, will be even bigger, and that, we'll work together to make a real difference for Canadians.
Thank you very much. Thank you all for this very rich and insightful discussion. So please join me in thanking our panelists.